Hi everyone, my name is Ali Isaacson, and today I'm here to tell you about the Health Equity Incubator. This was an innovation developed by design team members listed here who contributed their time, creativity, and expertise. The design team sought to address the challenge of how to involve diverse expertise and lived experience in the implementation of evidence-based practices, programs, and interventions to improve health equity in real-world settings. We know that the evidence base for this work exists. However, studies often lack the information needed by clinicians, managers, and policymakers who want to implement a proven intervention in a specific delivery system or other real-world setting. To address this challenge, the team developed the Health Equity Incubator. Community-based organizations and/or decision-makers would apply for implementation support to address a community problem. The applying organization would bring together a team with diverse areas of expertise. Accepted and awarded projects would receive funding, research, and advice to co-create evidence-based implementation strategies to address their problem. The results and lessons learned would then be publicly available through an open source library. It's important to note that the community-based organization would be at the center of the Health Equity Incubator to ensure that the interventions that are implemented directly respond to the needs of the communities experiencing the health equity issue. The Health Equity Incubator offers financial and technical support to participants to implement an evidence-based intervention to address a health equity issue. In exchange, the incubator asks participants to be committed to the Health Equity Incubator's mission, participate in incubator activities, and provide their organization's support to implement the intervention. The next few slides provide a fictional example of a successful project participating in the Health Equity Incubator. In this example, the partner organizations are seeking to address maternal health inequities in their community. The Louisiana Doula Project partnered with Harlow Health. They've worked together before and have established trust and rapport, as well as aligned values and goals. The two organizations jointly apply to the Health Equity Incubator for funds to support staff time and salaries as they apply to a larger grant. Once awarded, the applicants have access to project management and resources, such as a health services researcher, to help with their application. If their grant is funded, the organizations will have the ability to expand reach and address the maternal health disparities identified in the community. Afterwards, the Louisiana Doula Project and Harlow Health add their resources to the open source library to share with future awardees. An indicator of success at the conclusion of the project is that all organizations involved find value in their experience with the Health Equity Incubator. During their time together, the design team created several resources to launch the Health Equity Incubator, including a detailed manual, 2 requests for proposals, an applicant informational webinar deck and outline, findings from tests conducted, and others that will prepare the incubator for next steps. We learned several lessons along the way. First and foremost, all partners applying to the incubator need to be committed and aligned in their goals and values. Also, partners need an established working relationship prior to applying to the incubator. Lastly, health equity issues affecting communities are extremely personal, and it's best to keep those involved local and bring in local expertise when possible. As for next steps, Academy Health is currently exploring funding channels for the Health Equity Incubator. The quality materials created by the design team will benefit the funder, as the incubator will be ready to launch once funding is secured. If successful, we envision that the Health Equity Incubator will work with local communities to improve health equity issues by implementing evidence-based interventions adapted by a knowledgeable and diverse team of local partners.